Our guest today is Nikolas Ajkay. He's a professor in surgical oncology at UofL, and he did a study on breast cancer and how the Obamacare had impacted the breast cancer care rate. So, Dr. Ajkay, good to see you. Glad you're here.
Thank you for inviting me.
All right, let's talk about your study. What were you looking for?
Well, we wanted to see what was the impact of the Medicaid expansion in Kentucky. We learned that the Medicaid expansion allowed to insure a lot of patients, a lot of people in Kentucky. It decreased the uninsured rate from 19 to 7%, one of the biggest, if not the biggest, in the nation. And because breast cancer has very clear parameters that you can measure, quality parameters that you can measure, we thought that it would be interesting to understand what was before and what happened after the Medicaid expansion, in specifically what relates to breast cancer. So we went to the Kentucky Cancer Registry. It's a large registry that very many hospitals in Kentucky participate in. They include all their patients. And we compared patients before and after the Medicaid expansion in relationship to what stage of their cancer were they when they were diagnosed, how quickly they got their care, and what type of treatments they got. Specifically, were they able to save their breast? They received radiation when it was indicated. What was the time between surgery and chemotherapy? And the study found, interestingly enough, that after the expansion, which was approximately 14th, we made a cutoff at the beginning of 2014, there was an increase in patients being diagnosed at an earlier stage. The earlier you diagnose the cancer, the better it is for the patient. And that also translated into less invasive and complicated operations. More patients were able to save their breast after the expansion. And interestingly enough, more patients were getting radiation. One of our partners in radiation oncology several years back looked into how many patients receive radiation after breast conserving surgery, which is removing a cancerous lump, leaving the rest of the breast. Only 60% of patients were receiving radiation at that time. The Medicare expansion increased the receipt of radiation therapy up to 80%. So everything was very, very positive for Medicaid patients.
Mm-hmm. Once the expansion happened.
Once the expansion, we compared pre-expansion to post-expansion.
And so the Medicaid was expanded in Kentucky in 2014 or 2015?
Well, we used 14 because that was when the expansion rolled in. Yes,
gotcha.
Exactly.
So that was the last year. So you looked at what, 3 or 4 years beforehand, and then a couple years after?
We looked back to 11 and forward to 16.
Okay. And so you're talking about thousands and thousands of women in Kentucky, I suspect, that had breast cancer over that time frame, right?
So the total database included 20,000 patients.
Oh, wow.
And they were almost evenly distributed before and after.
Okay. So you had a really good sample size. Okay.
Yes.
What did you attribute that more and more women got earlier detection? Was it just the fact that they had insurance and they, decided, hey, I can go see the doctor now because I've got Medicaid, I'm covered by Medicaid, so they went to see their primary care physician earlier?
That is one possible explanation. Many of the early stage breast cancers are detected by mammography before the patient has a symptom. They don't necessarily have to feel anything in the breast. They have a mammogram, a screening mammogram, and the mammogram shows something. Those are the early stage patients which we saw a greater percentage of after the expansion. We tried to see if there was an increase on mammography use after the expansion, but we saw a trend since 11 of increased mammogram use. There are other programs that have been in place before the expansion that have increased mammogram use, so that's probably one explanation. Another explanation, as you said, the patients are more likely to come to see their physicians. And another explanation is probably other patients are less likely to put off getting screening or putting off a symptom because now they know that they have insurance. So that financial aspect probably is less important once the expansion rolls in.
I gotcha. Again, we're talking to Dr. Nikolas Ajkay. He's an assistant professor in surgical oncology at the University of Louisville. This is a segment we call Better Health Together, sponsored by Passport Health Plans. And let's go unpack those numbers that you talked about and the percentages. The number of women that the fewer number of women that needed reconstructive surgery and needed surgery to take out, some breast cancer. What was that number again? What was the reduction in the number of women that needed surgery?
Well, they all need surgery.
Well, they all need surgery, but
the different
tougher surgery.
Yeah, exactly.
Okay.
So when you have breast cancer, in terms of surgery, you have two options. One option is lose your breast. One option is save the breast by removing just the cancerous lump and have radiation.
Gotcha.
Obviously, losing your breast is a bigger operation and is needed in some situations regardless. But patients with early stage breast cancer with a small cancer, they might be able to save their breast, followed by radiation. So before the expansion, approximately 40% of patients were able to save their breast. After the expansion, that number went up to 50%. So there was a significant increase. Those are operations that are smaller, usually done as outpatient. So the patient loses less time, work time, and likely decreases healthcare expenditures because they don't require the admission to the hospital. They don't likely require reconstruction. Mm-hmm. So they're likely not only less operation for the patient, but also less expensive for the health system.
Again, we're talking to Dr. Nikolas Ajkay from the University of Louisville, and we're talking about breast cancer detection and prevention, well, not prevention, I guess detection of breast cancer in women who were benefited by the Medicaid expansion. And the women that you see, you're a surgeon,
yes,
right?
Sir.
Are you still seeing that the numbers of women coming in and that are detecting breast cancer earlier is still carrying on? Because this study finished up in 2014, right? Or 2016, I'm sorry, 2016.
The database finished in 16.
So you've had a year and a half or so of more surgery since then. Are there still, anecdotally at least, women coming in and more women coming in and getting early treatment?
Yes, so my practice, I only see patients with breast cancer and breast diseases. And we unfortunately see the whole gamut from very early stage to late stage breast cancer. But a good portion of my practice is early stage. And as I said before, those are patients that likely were diagnosed via mammogram, not because they felt something. If the tumor is small enough that you feel it, we can only see it on a mammogram,
right.
It is less likely that it will be in the lymph nodes. It's less likely that it's going to spread. It's less likely that they will need aggressive therapies like chemotherapy, for example. Right. And those patients have a better survival. So it is very important to detect breast cancer early. And it appears on this study that the Medicaid expansion has allowed patients to be seen earlier, treated earlier with less aggressive therapies.
I guess since I've got you here and you're a surgeon that deals with breast cancer, what's been the recent developments in this? Has there been some good developments in surgery regarding breast cancer?
Yeah, breast cancer is a very fast-moving field.
I guess that's good, right? That means the technology is helping out.
Exactly, it is very good. Kind of to give you a quick nutshell of what's happened in breast cancer. Since the 1970s, surgeries have gotten less extensive. We know that the extent of surgery doesn't really affect the survival. What affects the survival is the combination of treatments. We're doing better surgery. We're doing better surgery and surgery that's less morbid for the patient, less aggressive. We are doing better radiation therapy that affects less the organs. But also we have very effective systemic therapy that covers the whole body. We now have patients that receive chemotherapy before surgery, and when we do surgery, the cancer is completely gone. It is very, very reassuring for patients. And the imaging studies are detecting cancer much earlier. The radiology doctors are getting so much better at seeing these little cancers, detecting them at a preclinical stage. So I tell my patients in the 1970s, a survivor of breast cancer was the big highlight of a survivorship event. Right. Now, breast cancer survivors are everywhere. Breast cancer treatment has significantly improved in the last 30, 40 years.
And before we wrap this up, what would you like to say to women out there from your perspective?
First of all, know your body. Get mammograms if you have a symptom. Come to see your doctor as soon as possible. And as women, you're going to have other family members with breast cancer. support them through this journey. Breast cancer is a devastating situation for many patients, and family and society support is so important.
Very good. This segment's been called Better Health Together, sponsored by Passport Health Plans, sponsor of the University of Louisville and a partner with the University of Louisville. And you've been talking to Dr. Nikolas Ajkay, who is an assistant professor in surgical oncology at the University of Louisville. Dr. Ajkay, we appreciate your study of this important issue and appreciate your good work.